Hello everyone, my name is Paria and I'm going to be showing you how to do the exercise called cheek puffs, also known as air puffs. This exercise is actually working the facial muscles. It's coordinating the lips, cheeks, throat, and floor of the mouth. This exercise, key takeaway points are you want to make sure a patient is nasal breathing and having a lip seal the entire time. Usually when I have a patient do this exercise, I'll have them start with puffing air into the right cheek, then moving it into the left cheek. And if they can do that, then I ask them to move it into the upper lip and lower lip. You want to have the patient hold it in each section for about 5 seconds, then completing about 10 rounds of this. Let me show you how it's done. And that's how it's done. That was one round. Few things to look for while a patient is doing this exercise. You want to make sure they don't have any jaw shifting or have any compensations with the neck. Let me show you what that looks like. Couple things to remember is reminding the patient to breathe through their nose. And also, if a patient has a hard time doing it with air, you can try having them hold a little bit of water in each section instead of doing the air first.
Hi, I'm Stephanie Estrada, an Orofacial Myofunctional therapist with the Breathe Institute. Today I'm going to show you a clicking exercise with a mouth prop, and the purpose of this exercise is to teach tongue suction to the palate and tongue endurance and coordination. And this is a more advanced exercise to help with jaw stability and disassociation of the tongue. So first you're going to get the mouth prop and bite on the small end, and you're going to have your cheeks back with a smile and click. You're going to want to scan your face, neck, and shoulders for any tension.
Hey, my name is Miriam and I'm an Orofacial Myofunctional therapist here at the Breathe Institute, and the exercise that I am going to demonstrate today is called the lingual palatal suction, also known as the cave suction or suction hold. What I like to tell my patients when they're doing this exercise is I have them start with a tongue click, and I tell them that feeling they feel when their tongue sticks to the roof of their mouth, if they can just hold that position for us, like that. A few things that I do look at when our patients are doing this exercise, I want to make sure that they're not elevating the floor of their mouth, shifting their jaw forward or to the right or to the left, or if they're engaging any of their neck muscles. We have them hold it for a few seconds, 1 minute or 2 minute holds, and this exercise helps with tongue tone and tongue position. Thank you.
Hi, I'm Kathy, and I'm one of the Orofacial Myofunctional therapists here at the Breathe Institute. So today I wanted to show you the exercise called puppy tongue, and it's kind of a fun name, but essentially what it is you're just basically relaxing your tongue just outside of your mouth, and you're making sure that you're not using your lips or you're engaging your neck or anything like that. So we like to call it puppy tongue because it's kind of a fun name for kids, but essentially what it is just a flat tongue. So it looks something like this. That's it.
Hello, my name is Sandra Luz Gonzalez, and I'm a surprise myofunctional therapist, and I'm here to demonstrate tongue trace. So the goal of this exercise is to trace the tip of the tongue behind the incisive papilla from the hard to the soft palate and back without using compensatory movements, and I'll show you both. So this is without compensation, okay, and this is with compensation. any kind of facial grimace, jaw protrusion, neck engagement, anything other than the tongue moving, we know we are compensating. If you are having a patient who is struggling with this, we can use a bite block. I can start at the lower end or go to the middle. I will demonstrate medium vertical opening so that, and I will put it on the side. You'll always want to make sure your patients use it midline to keep balanced jaw joints. But here, and make sure there are not tons of bite marks into this because you know your patients are really compensating here. Hope that helps. Here to help. Happy to help.
Hi, I'm Leslie Kupiak, and I am an Orofacial Myofunctional Therapist with the Breathe Institute. Today, I'm going to be demonstrating a side-to-side exercise with the tongue. There are many variations of this exercise. You can always step the exercise up or down depending on where the patient's needs are at that time. But the three goals I really focus on, number one is jaw stability, in that you do not want that jaw to lateralize with the tongue. So keeping that jaw stable is always first goal. Second, I see, can they lift that tongue off of the teeth as they're going side to side? Because that's really going to help with tongue strengthening and tongue tone when you're not using the teeth as a crutch. Goal 3 is to really slow down the exercise. I want them to take about 5 seconds to go from one corner of the mouth all the way to the other. Again, very slow and controlled, which in the beginning generally is a challenge, and you'll see a lot of shaking of the tongue, or the tongue almost having a mind of its own where it just wants to whip back and forth because they don't have that ability to really move the tongue yet without use of jaw. So that's what I look for in this exercise.
All right, now that you have seen some of our myofunctional therapy exercises that we do at the Breathe Institute, we are going to have a conversation around taking those exercises and actually customizing them for our patients. So Sonda and I think this is something we really bonded over when we first met and started working together. It's not just giving our patients a sheet of exercises, right, Sonda?
Right, absolutely. And I know we are always being asked, well, what exercises? And I'm here to tell you that actually you need to evaluate the patient and to understand what the patient needs. And we always talk about, we start kind of a set of exercises, talking about the tongue on the spot and the cheek and lips. However, we need to figure out where the patient is, right?
Yeah, so we look at the patient in front of us and we decide, okay, can they do this exercise? And is it easy for them or is it difficult for them? And based off of how the patient does the exercise and their own unique abilities and skills, we can step up the exercise to make it more difficult or complex for someone who's pretty skilled, or we can step down the exercise to something more basic. And this is actually a term that I learned from Sonda. So the stepping up versus stepping down, if you can remember that, it can really help you customize treatment.
The exercise I totally love, but I feel it's an extremely complex exercise, is the TikTok. And I choose to discuss about TikTok because it takes you to 3 different extremely important levels. It is tongue posture, it is cheek and lips coordination during use of the tongue, and then it is suction. Is that the patient initially able to do that, or we should actually cut it in small pieces and to have one step at a time? And I'm sure you have a favorite exercise to talk about as well.
Yeah, I think you can take any exercise, and maybe we have an exercise like the lingual palatal suction. Every patient that we see will have a unique challenge with that exercise, and they will have a unique compensation pattern. And so we might give 3 people the same exercise, but coach them and instruct them individually and differently based on their abilities and their challenges. And that's what makes the therapy individualized and customized, and it's not a one-size-fits-all treatment protocol for every single patient, even if we're using some of the same exercises. So I hope that helps. Anything else you want to say, Sonda?
Customizing. Keeping in mind the patient needs, what they can do, meet the patient where they are. So
Exactly.
thank you.
Thank you.